So two major hot topics have been discussed extensively at the BTOG meeting. The first is CT screening. CT screening is absolutely critical to identifying patients with early stage tumours and improving lung cancer mortality. We now have the Nelson data, which has been published in the New England Journal, and that clearly demonstrates an improvement in lung cancer related mortality with CT scans compared to usual care. And I would like to think that in the UK we are very much leading in this area of implementation of CT screening at scale. We have a number of pilots occurring, all coordinated in a homogeneous manner, all coordinated with similar protocols, all coordinated with similar translational data underpinning this, both biological and clinical data as well. And it's really important that we continue to work to implement this at scale to identify the patients most likely to benefit from this. And I think there are a number of different ways that this can develop further. The key issue is really how do we identify those at-risk patients that can benefit from a CT scan. And there are a number of research programs within the UK that are looking at that, and I very much look forward to data on that in the next few years. The other area that's of key importance is reducing the mortality through rapid and early diagnosis. This is ensuring that patients who are symptomatic, who do see their patient with worrisome symptoms, get not only a rapid diagnosis through the diagnostic pathway, so the National Optimal Lung Cancer Pathway, but also don't get diagnosed in the emergency room. And there are a number of different things that can help towards that, and these have been highlighted by the launched UK LCC report, which I very much encourage everybody to read. And that very much highlights what we can do to ensure that we pick up cancers quicker and we diagnose them faster. The clinical expert group of NHS England have been working with experts and other organisations to plan a timed pathway with diagnostic bundles so that investigations can all occur in parallel rather than sequentially, with mandated minimum timescales between investigations, and now also a minimum time frame between diagnosis and staging and also starting treatment to ensure that patients really get started quicker, they're in better physiological reserve, and hopefully outcomes will be better as well.